As the self-declared spoiler of the health care reform bill that will begin debate in the Senate next week, exactly whom does the junior senator from Connecticut represent? The 334,000 people in that state, 10% who do not have health insurance tonight? Or Aetna, just one of the health insurance behemoths that have its corporate headquarters in Hartford. Our fifth story in the countdown, Senator Joe Lieberman declaring that under no circumstances will he vote for a bill that contains a public option, and he still caucuses with the Democrats because the man that Time magazine has this week dubbed the senator from Aetna, drawing his line in the sand in an interview with the Wall Street Journal, telling the newspaper, quote, "I'm going to be stubborn on this," refusing even to accept the trigger compromise proposed by the Republican of Maine, Olympia Snowe. Once the government creates an insurance company or plan, Senator Lieberman adding, the government or the taxpayers are liable for any deficit that government plan runs, really without limit, except, of course, for the projection by the Congressional Budget Office that the bill will save the government money, will reduce the federal deficit by $130 billion over its first decade and by as much as $650 billion over its second decade. In addition, healthcare reformers of all political stripes telling Ron Brownstein of the Atlantic.com that the bill appears to be the best effort yet to contain costs. Mark McClellan, former Bush administration official, brother to Scott, saying of this cost containment measure attempt in the bill, quote, "It would be good if more could be done, but this is the right direction to go." Jonathan Gruber, the leading health economist at MIT, adding, "I'm sort of a known skeptic on this stuff. I can't think of a thing to try that they didn't try. They really make the best effort anyone has ever made. Everything is in here." Politico.com reporting that President Obama made Brownstein's blog post with that analysis required reading in the West Wing over the weekend. In a new survey from the nonpartisan Robert Wood Johnson Foundation, 79% saying it is important for the president to include health care reform in addressing the nation's economic crisis. Another poll from public policy polling showing that the outcome of the health care debate could weigh heavily on the Democrats' chances at the midterms next year. If Congress does pass a health care reform bill with a public option in it, the Democrat leads generically 46-41 on the 2010 ballot. But if Congress fails to pass any kind of reform, respondents are then split 40-40 between the generic Democrat and the generic Republican. An actual Democrat in Congress wondering aloud here on MSNBC this morning why Senator Lieberman has been elevated to such prominence.
Where did this number 60 take on so much resonance? All we're asking is let the Senate consider these issues one by one. If Joe Lieberman carries the day, so be it. But if he doesn't, he shouldn't stop everyone else from voting on it.
Time now to call in our own Howard Fineman, senior Washington correspondent for Newsweek magazine. Howard, good evening.
Hi, Keith.
The senator told the Wall Street Journal today he's against the public option because it would increase the federal deficit, even though it won't. In September, he told reporters he was opposed to it because Americans don't want or support the public option. Statistically, in all polls, they do. In August, he said it was because the country is in a recession and we needed to wait, even though lowering health care costs would help the economy by the measure of any kind of economist. In June, he said it was because the private insurance provides plenty of competition already. Obviously, that's not true, and the insurance industry knows this, otherwise they'd be in favor of this bill. Washington Monthly noted he has had a different reason each month since June. Is Lieberman just making this up as he goes along?
No, he's doing it very deliberately, at least in the eyes of the other Democrats in that actual Democratic caucus. If you talk to Joe Lieberman or his staff, and I do, as recently as today, they insist that he favors reform and regulation, federal regulation of the health insurance industry to prevent abuses like denying people coverage for pre-existing conditions. But it's the widespread belief in the Democratic caucus, in the Democratic cloakroom, that Joe Lieberman's main aim is to kill the bill. And he will say or do whatever is necessary from his point of view to do it. That's the widespread view among other Democrats on the Hill.
If a Republican from Maine, even a fairly moderate one like Olympia Snowe, floats a trigger compromise that would preserve at least some form of public option, however watered down it is, the question then becomes among the Democrats, why do they even talk to Lieberman at this point? Who cares if he pretends to caucus with the Democrats if they can possibly get Snowe cheap?
Well, they're asking themselves the same question, Keith, and I talked to some of the Democratic leadership today, and they said, yeah, they think that Lieberman is pretty much of a lost cause, as I was just explaining. He did vote to bring the bill up, but you remember Harry Reid said, I'm not worried about Joe Lieberman in terms of bringing the bill up. That meant he was very worried about him on final passage. And they are talking to Snowe, and they are talking to Susan Collins, the other senator from Maine, and they are looking at the trigger, and they are hoping to maybe, and they may have to, get a Republican vote.
What about progressives who do not want even the trigger or any other watered-down public option? Why is this not the route? Kill this bill and resolve as much as you can using budget reconciliation, the 51-vote process.
Keith, that may ultimately be the saving grace at the end, but that's certainly nothing that Harry Reid or the Democratic leadership in the Senate want to talk about now. They don't dare talk about it because it's a thing of last resort. It would be full of all kinds of procedural traps in the long term. And I think they're also worried about some kind of loss in a big vote, changing the psychology in a way that would then get out of control. I mean, they're trying to make this case about cost savings. The president understands it's the key thing. That's why he sent Ron Brownstein's thing around, because that's the key to holding the majority together and trying to get that one Republican vote, maybe two Republican votes.
Are they still of the mindset, Mr. Reid and the president, are they still of the mindset that any victory is a substantial victory, because even if it just moves the ball an inch forward, it does that, and also that since the Republicans are clearly opposed to any kind of reform, defeating them is symbolically almost as important as making real reform?
Yeah, it's both. It's both. And there are all kinds of reform measures in there, as others have said, as you were repeating. But as far as Joe Lieberman is concerned, I mean, they've noted, for example, as others have, that, you know, when Mitch McConnell was speaking in the close of debate on Saturday, the Republican leader in opposition to any bill, Joe Lieberman was sitting on the Republican side of the aisle. When Harry Reid and the Democrats were speaking to close the argument on Saturday, Joe Lieberman moved over to the Democratic side of the aisle. So they're dealing with a guy that clearly has issues. They're focusing on passing a bill any way they can.
Howard Fineman of MSNBC and Newsweek, as always, great thanks, and have a great Thanksgiving.
You too, Keith. Thanks.